Hello, everyone, and a warm welcome to the first edition of our Directions Live Online by Esri Malaysia. My name is Ami Faisal, and I'll be your host for today's session. Now, just a reminder before we get started that we are recording today's session, so we'll be sending out a link to the recording later this week. So if you want to rewatch it, you have that available to you. So also, do ask questions. So you can do this at any time during the presentation by adding your question into the GoToWebinar panel on the right-hand side. So we've got plenty of time at the end where we can answer any of your questions. So introducing today's presenter is Wan Muhammad Nazmin, a solution consultant at Esri Malaysia, focused on the national security sector. So he holds a bachelor degree of science in geoinformatics from University Technology Malaysia, UTM, and has a strong background in spatial industry, previously working with AAM Sdn Bhd as an imagery processor, providing raster solutions to clients worldwide. In this particular webinar, we shall learn how geospatial technology has helped government authorities and health agencies map and monitor COVID-19 cases and track its spread by contact tracing using insights from dynamic data. We will take a closer look at how this data can help identify at-risk populations and locations to inform preparedness and response plans for emergency and hospital staff. So without any further ado, I shall pass the presentation to Nazmin. Over to you, Nazmin.
Okay, good morning. Thank you, Amir. And also all of you that are able to join and spend time with us for this online Direction Live webinar. Okay, firstly, I will explain to you about the geography and location analysis that have a crucial role in better understanding of the evolving pandemic. GIS is a complete system to understanding and respond about the pandemics that involves in supporting that can have support the key mission of the surveillance, planning, logistic, field operation, executive awareness and management, as well as community engagement. Okay, using GIS in your organization, you can have a more effective for the risk assessment, for the threats evaluation, to monitor and track any updates of your field workers, to maintain situational awareness, as well as to have a better communication with your stakeholders and also public. This system is already being used by thousands of organizations presenting information and analytics during this pandemic of COVID-19, which is to identify the vulnerable population, the healthcare facilities information, as well as to report the daily cases of all the countries around the globe. And I'm pretty sure you are familiar with some of these publicly available dashboard application, especially the coronavirus COVID-19 global cases that have been developed by the Center System Science and Engineering at Johns Hopkins University, which is they share to us on what is going on about the latest information of COVID-19 in every country. This same pattern has also been applied in WHO, the World Health Organization. Okay, the application involved is the integration of the predictive model, and this one, which is called a SHIME model, integrate with mapping solution so that we can actually forecast the curve of the epidemic that can give impact to the facilities such as the healthcare facilities and various geographies. GIS can integrate in various types of data, And in this case is to integrate the tabular information with other significant information during this pandemic situation, such as the vulnerable population, the relationship between hospital resources, as well as other spatial data. And the output of this information will brought together in a format where information is easily can be shared as a service. Okay, next I will continue to explain more about the COVID-19 Response Hub, where it is a centralized site that you can get maps, datasets, application, and also the information related to COVID-19. Under the disaster response team program, Esri has offered the Coronavirus Response Hub template, which is can be includes in your organization, and you can easily and rapidly configure with your own branding, and also to share any data resources, map, application, and also information within your local community or in a region. There's also a step-by-step video of activating and configuring the template, which can you can easily and rapidly deploy to your organization. Okay, we in Esri Malaysia actually have this one set up to be accessed by public. This COVID-19 GIS Hub Malaysia bring resources together to help a community in finding an authoritative content and application. Uh, all the maps and application have been created by the disaster response team from Esri Malaysia, as well as other organizations that we work together to mitigate the impact of this pandemic, COVID-19. Okay, by accessing to COVID-19 GIS Hub Malaysia, you can get access to multiple local and global application that, of course, can give lots of benefits and huge impact to your organization and also to a community. It is a site which you can get the latest update information of COVID-19 in Malaysia as well as global. Later on, I will show a glance through how the COVID-19 GIS Hub Malaysia looks like, which is you can also access it to your device. Okay, at the top of the hub, you can see the daily cases reported in Malaysia, the spatial location, the COVID-19 graph to monitor how and when it can be flattened, the graph to show the cases of each state, the latest information and announcement, the collection of Twitter feeds from the relevant organization, the videos, the gallery of GIS application, the application that have been developed by other organization, as well as the global GIS application that can publicly available, as well as other relevant information that might be useful for the public. Okay, since this GIS hub are easily configured and can be rapidly deployed, there are lots of COVID-19 GIS hub that you can access in various countries, such as Indonesia, Belgium, New Zealand, Australia, Africa, Canada, even Iraq, and also Mexico. Okay, next I will explain and show to you some GIS application that have been developed for COVID-19 in Malaysia. Okay, during this pandemic situation, all the important data must be updated as real time as possible once it is officially announced by the Ministry of Health. In order to achieve this, an application has been configured, which is called the Malaysia COVID-19 Daily Cases Reporter, to update the daily COVID-19 cases reported, such as the numbers of new positive cases, death cases, discharge cases, the number of patients in ICU, as well as the patient that needs the ventilators. It is a smart and flexible reporter application that you can access through the various platforms, either in your laptop, mobile phones, and also tablets. So we can update the data anywhere and any device. Okay, from the data that have been captured using the smart survey, we are able to analyze and visualize this data in the form of statistical and graphical information, which will bring more insight of this data using what we call it GIS dashboard application, which is also can be accessed in various platforms so that you can get the latest information anywhere and anytime. From this Malaysia COVID-19 dashboard, instead of we're able to monitor the daily cases, it's also able to identify which states that have the highest cumulative cases, the daily active cases graph against the discharge cases to monitor the flatten of the chain curve, which age group have the highest death cases, as well as which genders that contribute the higher death cases. On top of that, in the same dashboard, you also can interactively visualize the spatial location of a total lockdown area, or we call it the EMCO, the Enhanced Movement Restricted Order, as well as the classification of district zoning, which is either it is green, yellow, or red zone, based on the cumulative and active cases. You can get the access to this dashboard by having the link in our hub. Okay, next I will explain more on how you can deeply explore the COVID-19 data to gain more insight and analyze the virus spread and its relationship using ArcGIS Insight application. Generally, it is a self-service location analytic workbench, which is to help you to jumpstart your analysis and to help organization, especially health workers, to respond efficiently and plan effectively using the GIS link analysis tools for the data visualization. Okay, by using this GIS analytic application, we are able to visualize the connection between the affected community members and also to understand how the virus is spread by having a relationship between the positive case ID with other information ID, such as the close contact ID and also the movement location ID. Okay, in the most cases, the patient information are being captured in tabular form, such as in Microsoft Excel. The challenge is how GIS can help health workers to analyze this information and to provide them a better and clear insight of the patient data that have been gathered to assist them, especially in contact tracing. Okay, next I will show you how we perform the linkage analysis using the sample data of Sabah. As you can see, the red feature is the location, the blue feature is the affected location, and the purple is the relationship of the cases and the location. And at the right is the relationship map so that you can see the density of the clusters and which location that have been infected. And when you click at the location, for example, the Pasar Sama, the other information will highlight that have the relationship between that location. And you can see the capacity of the location that might be meaningful to the health worker. As well as you can see the other information such as the severity, age, clusters, the tier in the family, the symptoms, the comorbid condition, as well as the nearest medical centers so that the health worker can identify the capacity of the beds available and also the ventilators available, also as the its medical status. Okay, this is an example of other application that you can use for uh, using ArcGIS Insight, which is to identify and evaluate the local population which is at risk, which is to help to identify how many senior citizens within the service areas of grocery stores and to estimate the number who would not be able to take the advantage of the internet-based delivery services, especially the vulnerable population in the rural area. Okay, the next application is how we can analyze the medical workforce preparedness, which is to understand how quickly staff can report to work base of travel time and can be used to manage the staff changing. Okay, next I will explain to you more about the application that has been developed by the disaster response team from Esri Malaysia to give the information to the public. Okay, the first one is the application to identify the high-risk population in the red zone area. It is the combination of the red zone area with the population so that we can get the information of the vulnerable population in district as well as sub-district. It is to make a standby or deploy more healthcare workers in the red zone area. This is example how the application looks like, which is you can search the specific area that you want, and then the map will show the total number and the percentage of uh, the vulnerable population as well as the zoning status. It is also publicly available that you can access in the COVID-19 GIS Hub. Okay, the next one is the application to identify the nearby essential service location, which is to identify and to view the detailed information about the designated hospital as well as the essential service facilities near your place. This is an example how the application looks like, which is you need to identify the buffer zone and you also can pinpoint the location of your area and the apps will show the listing within the zoning area and you have ability to navigate to that location. Okay, the next one is the application to identify the affected location, which is the map showing the location of positive cases, patients that have been visited based on the reported cases as well as the contact tracing. It is showing the spatial location of the affected places as well as when the case is being reported. It is important for us as a precaution to avoid visiting this affected location until it is being reported as being this infection. Okay, this is an example of the application, which is it shows the total location for each state, and you can identify the buffer zone for your location, and the apps will list all the information within the zoning that you have been identified. Okay, the next one is how GIS help in situational awareness for inventory. It is by having a solution which is a smart survey to do the inventory and assist the health worker to collect the hospitalization that might be related to the medical information from hospitals and also the acute care centers. The health worker also can use this survey form to identify the total numbers of personal protective equipment, the PPE, such as gloves, face shields, respirators, uh, gowns in that particular hospitals. And the data that have been captured can be viewed in the dashboard so that the health worker can identify the hospitals that have critically low in the personal PPEs supplies. Okay, the next one is how GIS can be integrated with the statistical model for the capacity analysis that might be give a high impact for the health administration. Okay, this one is called the SHINE model. It stands for the COVID-19 Hospital Impact Model for Epidemics, which is have been developed by the Penn Medicines, and it is important to help the policymakers and hospitals administrators to understand where and when and how large the peaks in COVID-19 related to the hospitalization capacity will be. So by bringing this model to GIS, it will aligns directly to the data source that can provide the means to visualize a problem that geographically entice the model output solution to design the immediate action. Actually, this model is important to project the number of hospitalized patients in the hospitals that can be accommodated in the next 19 days, and also to reflect the best and worst case scenario regarding to the future capacity of critical medical equipment such as beds and ventilators. Okay, this is an example how the output of the analysis can be visualized in the application. This application is called the Capacity Analysis Configurable Apps, which is available in ArcGIS Online and also ArcGIS Enterprise to project the capacity of hospitalization and beds using the integration of the SHINE model and the GIS. That's the end of my presentation. I hope this will give you some ideas on how you can make use of multiple of GIS data for the pandemic analysis that will give you a high impact to your organization as well as to the public. And you can access all the application as well as the hub using the link that has been shown here. Thank you, and I will pass over to you, Amir.
Thank you, Nazmin. That was a great overview of the mapping the spread of coronavirus. And I'm certain everyone found it interesting as well. So we've had a couple of questions come through. If you have been listening intently to Nazmin and you haven't had the chance to type your question, you can still do that. We have a couple of minutes to spare. So to kick off, we have one from, let me see, Ahmad Riaz Mazli. I guess you covered this one. The question is, hi, is there any modeling that's being used by Esri for predicting the curve? With you, Nazmin.
Okay, actually, like I mentioned before, we have used the Shine model to integrate with the GIS data, such as the capacity of the hospitalization and also the percentage of the social distancing to project and to predict uh, how this curve might be affect the capacity of the hospitalization equipment, such as the critical equipment in medical locations, such as beds, PPEs, and also the ventilators.
Great. So we have the next question over here from Rashid Sharif. The question goes is, do you have coordinates of where infections occurred?
Uh, like I shown before, yes, we do have the what I understand from the question, it is the location that the positive cases have been visited. Actually, we do have the service layer that might be accessed to your organization, which is it is reported from the other organization, and we use that information in our application. And the information is not directly from Esri staff, I mean from us, it is from other organization. We just use that service and we integrate with our application.
All right, thank you for that. So the third question is from Muhammad Amir. The question goes is that GIS analytics is a ready template to analyze the relationship. So I guess the question is about asking if there's any template to this, if I'm not mistaken.
Okay, I understand that it is related to the GIS Insight. Actually, uh, it is not a template, but we have a sample model that you can use, which is to identify the relationship. It is very easy for you to deploy this model in the GIS Insight. It is as easy as you just drag and drop your existing or the model in CSV, and you can do the relationship by identify which field that you need to relate from one document or CSV to another document. For example, which is uh, we need to have the relationship between the positive cases to the close contact and also the movement. It is in different document, but having ArcGIS Insight in your place, you can do this kind of relationship analysis.
All right, great. Thank you, Nazmin. So we have the last question here from, let's see, Muhammad Azamuddin Mustafa. What kind of application platform that can update real-time data which can integrate to the dashboard platform created? So I'll repeat the question. What kind of application platform that can update real-time data which then can integrate to the dashboard platform created just now? Over to you, Nazmin.
Okay, actually, as we have provide various application that you might use. In fact, if you are the existing ArcGIS online user, Esri have prepared a lots of solution which you can deploy in your ArcGIS online. An example for the application, one of it that I shown before is the smart survey form, which is called the Survey 123, which is you can use this application in multiple devices, and this data that have been captured will be directly visualized in real time to your dashboard. Other application, it is called the collector for GIS. It is meant for the data collector in the field. And also we do have lots of web application which you can configure to update any data. And yes, it is can be directly integrated to the dashboard.
All right, great. Thank you, Nazmin. So we do have more questions over here, but unfortunately, that's all the time we have today. So if we have not answered your questions, Nazmin will surely reach out to you with a response later. So moving on, just a little bit about what's coming up next on our webinar series. So on the 21st of May, we'll be having a specific presentation around workforce for ArcGIS. So this is one of the apps that is available within ArcGIS, and it will focus on field operatives that can leverage workforce application and other field applications as well. So this will be presented by Siti Rohana Tazura. And on the 3rd of June, we will have a webinar on creating and sharing 3D GIS content by our presenter Zatil Husna. And lastly, on the 24th of June, we'll take a look at the aspect of security within ArcGIS through the ArcGIS Security in the Cloud webinar. So this webinar will be led by Muhammad Akmal. So do keep a lookout for this space, esrimalaysia.com.my/webinars for any upcoming events and webinars. So lastly, we really love your feedback. So take the time to fill out the brief survey that you will see pop up at the end of the session. And further feedback or questions can be sent directly to events@esrimalaysia.com.my. And finally, if you would like to re-watch this webinar or share with your colleagues, the recording will be shortly available on Esri Malaysia events page. And again, thanks Nazmin, and thanks everyone for joining us, and we will see you for the next Directions Live online. Goodbye.
Thank you.